after 10, last Friday in the month of February, last Radio Doctor for the month of February, the last day in the month, the last day of the week, of the last, no, it's not the last day, last working day of the second month of the year. Before we get into the best month of the year, my colleagues will be screaming. That's your business. We're going into the best month of the year, which is March, but we're happy that we can see the second to the last day of the month of February as we are.
What
Yes,
makes March? What makes March the best month? Is that what goes by to be a birthday
yeah,
month?
yeah, yeah.
It's a happy birthday in advance.
Thank you. So my colleagues have been hating on me, but that's their business. Because each time I start the shows we've had since morning, I keep on saying the best month of the year, but they're just haters. And it's understandable. That's all right. Everybody will be all right. Okay, this is Radio Doctor, your free health consultation program where real doctors advise real people. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise us on radio, right? Broadcast 10 a.m. to 11 a.m. Mondays through Fridays. My name is Fumi Bangbala, and our radio doctor this morning is Dr. Abiola Ajayi, the MD CEO of ROA Specialist Hospital. Good morning, Dr. Abiola. How are you this morning?
Good morning. I'm doing very well. And you?
Good,
How are
good,
you?
good. I'm good. Excited for the new month, but yeah, I'm good. I
I'm
don't
sure
think we have.
you're insufferable at work. I'm sure everybody's tired of you.
Yeah, to be fair, it was just today I did it to them, and they're acting like I've been doing it since the last 10 years. Just this week, oh, just this week. Not even this week, just today. Typically, what I do is I start from the beginning of the month of February and I'm peppering everybody. But I didn't. I had mercy on everybody, and then they're acting like, oh my gosh. But you see, today we're going to, and then when we now start on Monday, the countdown is on. All
No
the
problem.
best to everybody involved. If they feel like I'm insufferable, that's their business. This morning, I think it was Aisha that was saying, oh no, the analyst was like, oh, like what about the other months of the year? I was like, I really don't care, because this is the best month of the year. Every other month, so in the calendar, we have March and the other months, right? That's just what it is. Not every month of the year. March and the other months, we are incomparable. Finish. Anyway, so we're going to be talking about heart attacks, early signs, and emergency response. That's the topic for this morning. You already know that we are live on YouTube at WFM 917. You can also listen to us on the go via our website www.wfm917.com. Phone lines will be open shortly. 07000 or 09155 You can text or WhatsApp us on 08155 or 0703 537. Now that that's out of the way, Dr. Abiola, what exactly is a heart attack, and what is happening inside the body when it occurs?
It's a good topic, and it's kind of on the theme of what we've been talking about. We've talked about high blood pressure, and
Mm-hmm.
we talked about heart disease. So now we're talking about the consequence of both heart attack and heart disease. I'm sorry, heart disease and high blood pressure could lead, amongst other things, could lead to a heart attack. But a heart attack in the medical term, we say myocardial infarction, right, or an MI. And it happens when blood flow to one part of the heart is suddenly blocked. And what I tell patients is you have to think the heart is a muscle. So it's like a muscle that's pumping blood, obviously. Right? It has its own blood supply that supplies muscle, just like any muscle. And if it's starved of oxygen, then that muscle will, of course, give you pain, and then, of course, the muscle cells will die, and you can now start losing function. It's very simple. What happens if, I don't know if as a kid you ever took a rubber band or a string and um, tied it around your finger, and
Mm-hmm.
you leave it for a minute, 2 minutes. After some time, the pain becomes almost unbearable, right? And that's because of lack of oxygen supply. So the cells that don't have oxygen are screaming, basically screaming at you that something is wrong. Same thing happens in your heart. When blockage happens, oxygen supply stops, and heart muscle cells start to die within minutes. And of course, the longer the blockage lasts, the more muscle damage that occurs. Why this discussion is important is, like in the States, a person dies every 40 seconds from a heart attack.
Hmm.
And worldwide, that accounts for about 20 million deaths annually. In Nigeria, it's about 15% of deaths are related to heart attacks. So I pray that you're not someone that has one, but you will probably know someone in your lifetime that does. This is something that affects everyone.
Hmm. Thank you so much for Dr. Bella. Some people mistake, or is it mistake? Yeah, heart attacks for cardiac arrest. What's the difference?
The easy way to separate heart attack and I'm sorry, there's like maybe it's an engineer. If he could be the engineer can
An
mute his
echo. Yeah, I've been trying to reach
yeah.
them. Yes.
Okay. So um, a heart attack, the easy way to describe it, a heart attack is a circulation problem. A cardiac arrest is an electrical problem. So muscle gets electrical signals from nerves, just like your hand muscles, your finger, your arm muscles get nerve impulses from yours. So when you have a interruption in your heart, then it becomes cardiac. We discussed what heart attack is. That's circulation. So when circulation stops, you can have a heart attack. At the end of the day, both of them will cause blood to stop pumping. And typically in cardiac arrest, the person collapses immediately, and about 350,000 cardiac arrests occur outside of hospitals yearly. And in Nigeria, we don't know the exact statistics, but for summary, heart attack is blood flow, cardiac arrest is the heart because of no electricity. Let's put it that way.
Okay. Um. So when they say a person had cardiac arrest, it's not really that the person had a heart attack, because I most times I think I've heard more people say cardiac arrest than heart attack.
Yeah,
Right.
so yeah, it's a cardiac arrest. If you're a person that's standing upright, cardiac arrest, you're gonna drop. Your all the heart muscle stops. Every cell in your body stops getting oxygenated blood at once. You die. You may not die if somebody resuscitates you, but you're going to drop. In a heart attack, people, the classic sign is they feel some crushing chest pain, and you can kind of, if it's not a big heart attack, you can limp along and get treatment. So I wouldn't want any of these, but you definitely don't want cardiac arrest because that's incredible to deal with.
Next level. Because a heart attack can still be, what do you call it? You can still, you can still rectify it in a way.
Yeah, you can have different severity of heart attack. You can have a mild heart attack. There's some people that have heart attacks and they don't even know it. They're like, oh, I just had some chest pain. It lasted for
Yeah.
half an hour. And then, I calmed down. I put cool water on my face. And then I slowly brought myself. By the time I do an ECG or a blood test, I can see that you had a heart attack, recently. And, we can now work on why and solve that problem. Cardiac
Right.
arrest, you're not saying it. You're not talking to people. You're not giving anybody any history. You're not saying anything. You're gonna drop. And unless a medically trained person is right close to you, more than likely that'll be the end of you.
Mm-hmm. And then there's this, is it a myth? People just typically think that heart attacks only affect elderly people. But I've seen, even, I think I talked about this last week or maybe 2 weeks ago, I've seen young people who have dropped from heart attacks as well. And it was when they were doing something active. They were probably, I have a dear friend who passed on, I think 3, 4 years ago now, and he was playing football. He clutched his heart, and that was it. You know, so that's a myth, obviously, that it only affects elderly people, because it can affect anybody.
20% of heart attacks happen in people less than 45 years old. So
Hmm.
youth is not a protective, it's not protection. There and you're going to see more and more, especially in Nigeria, because we have higher amounts of hypertensive or high blood pressure is on the rise. Diabetics, there are still people that smoke, highly stressed professionals, those kind of things. I'm going to talk about it. Processed food, sedentary lifestyle, all those kind of things contribute. So, yes, you can definitely see it in the younger generation.
Hmm. Okay. Now, and then the what I think we've talked about this before. What are the earliest warning signs?
Or unusual fatigue. Like I don't know why I'm just all of a sudden dragging and I can't do anything. Usually you have sweating and you may be nauseated. Some few people from it, but a lot of people dismiss it as, oh, I just had gas, or I'm stressed, or I didn't eat well, or I didn't sleep well, and it's important to recognize these signs moving forward.
Because you said it feels like maybe someone's sitting in my chest. What's the difference between chest pain and heart attack? I think I've given this example before. I'm not sure if it was with you. How my brother had gone to the hospital and it was chest pain, but then they said it was like he had a heart situation. Of course, he didn't tell my mom, myself, and my sister. He told my dad, and my uncle had said, "Oh, Nigerian doctors, what do they know?" Because my uncle doesn't, he doesn't what do you say? He's not a doctor in Nigeria. He's abroad, and turns out that I think is it vertigo or something like that because of the nature of my brother's job. He's always in an upright position and he's always using his hands. So when the bag of drugs was this big, like this big, it was a heavy bag of drugs. They said they did ECG, they did everything, but it wasn't anything that had to do with the heart. It was more of a chest pain. So of course, like somebody else would have panicked and said, "Oh my god!" And then
Mhm.
let me just help myself and die or something like that. How does someone? I know I'm laughing, but it wasn't funny. How do you differentiate between chest pain and heart attack?
So you can have, and that's what makes a good physician, knowing how to distinguish. So you can have chest pain, and the first thing I try and rule out is the heart, right? So when we say chest pain, we're talking about central, somewhere in the middle of your chest. You can have chest pain there. Of course, we want to rule out the heart, but I would say 60, 70% of the time that I'm evaluating a patient for chest pain, it's something else. Peptic ulcer disease can, your stomach, the top part of your stomach is
Yeah.
inches away from your heart.
Mm-hmm.
So if you have pain there, you can misinterpret it as maybe from the heart. If Of course, there's even some infections that after you recover from the infection, you'll now start having chest pain. It's called costochondritis. You can have that, especially after some viral infections. There, I could list 10 different things that could cause chest pain, and none of them would be a heart attack. What's important is that if you're evaluating someone for a heart attack, yes, ECG is useful. There's some blood tests. Maybe we'll talk about that moving forward, and there's even something called an echo that you can do. But quickly eliminate the heart and then chase the other symptoms. It sounds like in your brother's case, they just went down one street and didn't turn around again, and it's dangerous because you can misdiagnose people easily.
Yeah, because what if he had started taking those drugs and didn't ask questions? What would have happened? Because I think my dad had said, no, call your uncle and
Mhm.
ask him, send him a message. Because that I typically would, and that's why I don't like going to the hospital because of this misdiagnosis. Like, are you sure that is what is wrong with me? I don't think, I mean, there's a difference between, oh, you've got Google to Google your symptoms, which can mirror another problem and all of that. But that's I, okay. Now, heart attacks in men and heart attacks in women, are they different? If so, how different are they?
In Yes, they are different, and so in women often have less dramatic chest pain. So the guy
Uh,
usually get pain, and but they may just have chest discomfort. And I've actually seen a patient having a heart attack in the office. A new patient was just sitting there, hadn't seen yet, was there for a checkup, and she just started rubbing the center of her chest really hard. I said, "What? Uh, what's going on?" Checked her blood pressure. Her BP was 200 and something over 100, and luckily we were right there, so we were able to relax her. But women, they have that less dramatic pain. They may be more fatigued. They complain more about the shortness of breath, the nausea, the less specific signs women have. So it's easier to miss a heart attack in a woman than it is a man. And we have to remember that heart disease, including which includes heart attack and all that, that's the number one killer of women worldwide. So it's something that is useful for a woman to know the warning signs as well.
So besides the rubbing of the chest for the woman, what other signs shouldn't be overlooked?
Yeah, just like the women, unusual exhaustion. So you're just tired and you're dragging, and you just don't understand why. Sudden breathlessness. So all of a sudden you may be doing something you do every day, or not doing much at all. That involves your arm, especially your left arm. It can even go up into your neck and into your jaw. Right. So those are some signs that women should never ever ignore. And if you tell people, if it feels, first of all, I tell patients three things. Number one, no pain is normal. Pain, your body is trying to tell you something, right? And that if anything feels unusual and intense, it should never be ignored. Right? So you have something unusual, you have something intense, and you just sit down and it goes away after an hour. That's not a cause for you to ignore it. That's your body trying to shake you and say, "Hey, you need additional help." So we should truly take it as warning signs.
So the moment you notice any intense discomfort or intense pain, go to the hospital. How do you strike a balance with Christians? I don't know if Muslims are like that in terms of, oh, it's not my portion, I'm healed in Jesus' name and all of that. But I know specifically for Olamaje, like, but I know, I think everybody does Olamaje actually. But I
Yeah.
think it's more peculiar with Christians in terms of, oh no, I have faith that I'm going to be healed. I'll give you an example. After I had my daughter, I think it's 2 years after or so, had gotten pregnant. And I mean, everybody was happy, da, da, da. Went to the hospital and they were like, so now I'm like, if I got pregnant now, I know the questions that would worry me. I know the questions that the doctor will ask me that will make me worried. So the doctor had asked to say, oh, I need you to do a scan. And I was like, There was a way he said it. I was like, nah, I'm professional here too. I've got listen. And then the next thing he said, oh, because we want to make sure that we hear the baby's heartbeat. And I was like, The third thing, so I did it. And then the next question they asked me was, when did you see your last period? As soon as they asked me that question, I said, yeah, it's all over. So, and right, I knew. I was like, because you cannot possibly be asking me when I wasn't coming to the hospital for the first time. I was already in the hospital. I was a patient in the hospital, an antenatal patient. And then you are my doctor and you're asking me, because it's right there in the record, right? When I saw my last period, I already like time up. So I done another scan and it just went downhill from there. And I remember leaving the hospital and I was praying. I was like, this is not my portion. I mean, of course, eventually I can smile about it now, but it wasn't funny. It was one of the worst experiences of my life. But I'm saying it because even me, who felt like I'm well educated, yes, I'm a Christian and everything, but I was like, never, it's not my portion. Until my dad dragged my ear and said, come, please, we have to go and take this out. We're not playing that game here. So how do you strike a balance with patients like that who are like, oh no, it's just normal pain. Oh no, I'm taking faith pills. Oh, I'm using my faith for it. How do you strike up? And I'm not saying that you can't use your faith so that Christians don't come for me. I'm just saying, I'm asking Dr. Abiola now, how does Dr. Abiola strike a balance with overly, like, let me take that back, with Christians and saying that they have faith that is not their portion and all of that?
Earlier in my Nigerian career, I used to treat those things differently because I didn't understand. Coming from the U.S., you, you don't bring God into conversations, right?
Mm.
Like here, people talk about God and Jesus like every day, is not normal. It's very normal to go months, years without discussing God with your colleagues. So when I came, I wasn't as sensitive to those things. I was just like, "Are you stupid?" Not, I wouldn't call pain stupid, but in my head, that's what I'm thinking. Like, are you?
Yeah.
But I now spend time in the community. So I went to visit some churches and I would give talks. And sometimes I would just go to the church and I would just be there, not on any official capacity. So this one is a large church. I definitely won't say the name, but the pastor came up, all of you that have come for this, God will cover you. You're covered by the blood of Jesus. You're this and that. Anybody taking medication for any ailment, stop taking it
Oh,
now.
yeah.
The Lord will cover you. That's exactly. I fell out of my chair because I fell to the floor. Like, what did you just say? It was a thousand plus people there, and I'm looking around. I'm seeing old women, gray hair. I'm seeing this and that. I'm like, are you telling Mama to not take her diabetic medicine? It's truth. I was there for like 4 hours. People, mom, falling, falling, falling. People I saw somebody clutch, but I wasn't comfortable running to help them fall, fall, fall. So that's part of it that we put this on natural or too much pressure on faith. I tell patients now that, do you have faith in God? Absolute faith in God? Yes. Okay. Do you believe God created man? Yes. Okay. Do you believe God created everything? Good. So God has already done His work by putting you in front of me as a doctor, and I actually know the medication and the treatment that you need for your ailment. And I'm telling you, this is what you need to do to stay alive. That's
Yeah.
God. That's God at work. Have faith in the treatment that God make. It doesn't have to be faith in me. Just have faith that God is in control. But to just say, I'm going to sit here, ignore this chest pain because the Lord has me, it's irresponsible to say the least.
Mm. Ah, okay. When someone develops chest pain at home, what is the very first thing they should do?
It's easier said than done, but stay calm, right?
Yeah,
Don't start
yeah,
running
let's
around.
do theory first. Let's do Did you say stay calm? Ah,
Stay calm. Yes, that's the very first thing to do if you can. Then I would sit upright.
okay.
Sitting upright always helps your breathing and can help your circulation. Any clothing that's tight or your tight necklace or something you want to remove so that you have free access to your throat. And if I have patients that were at risk, at a good risk for a heart attack, I would have had them have some aspirin, around, like something like that you can take, and just kind of relax until you can get to the center. But in those first few minutes, the most important thing is to stay calm. Make sure your circulation and breathing are free, and then now try and seek medical attention.
Okay. Can they drive themselves to the hospital?
I always say if the difference is waiting for somebody to come from, and we know how Nigerian roads are. I'm in Ogun State, and I'm waiting for my brother to come from Lagos to carry me. I'm gonna chance it and drive myself because minutes matter. It's not something that happens in the morning and you want to take care of it in the evening. By then, a lot more damage can be done. And it's in the states most people present between 2 and 6 hours of their symptoms. In
Okay.
Nigeria it's 6 to 48 hours. So, and in when we're dealing with heart attack, that first 90 minutes and ultimately that first 3 hours is where you can do a lot of work. Sometimes you can really reduce or mitigate how much damage the muscle will have taken if you get early intervention. Somebody coming 3 days later, it's a lot different kind of scenario.
Mm. Oh, okay. Okay. Now let's take it outside because this is like if you're at home. What happens or what should bystanders do if a person collapses and becomes unresponsive, whether at work, on the streets, church, mosque, wherever?
Yeah. So you know, they should, and in that case, I would advocate that someone who drives themselves. And I want to quickly say that if you have a heart attack, you have another one, right? You lose consciousness. So I'm not saying risk it. I'm just saying if there's no other alternative, please drive yourself. If somebody's around, the breathing is free, next free. The breathing is free, next free. Um, Water is fine, but I just say tap what they call tap the sponge on the forehead. But the main thing after that is get them to medical attention as quickly as possible.
I think I missed something at the beginning when it was a bit when we're having technical issues. A heart attack doesn't necessarily lead to death immediately, right?
Yeah, you're correct. A heart attack may not lead to death immediately. You can have
Okay.
minor heart attacks. You can have major heart attacks. So yes, it is a cause of sudden death, but not every heart attack has to kill you immediately. Which is why getting medical attention quickly is so important. You know.
So when people say, "Oh, the person died of a heart attack," it doesn't necessarily mean the person died of that particular heart attack.
It could have been a subsequent one. So if you have a heart attack on Monday, by Tuesday you have a 50% higher chance of having another heart attack. So
Right.
and usually they step up in severity. So if you have a mild one, you have a moderate one, then you have but it doesn't have to go that way. But that's typically how it goes. You can have a mild heart attack in January, and then if you're not really addressed what caused that first one in March, you can have a major heart attack, and that one you may not be so lucky. So it's because of the way
Mm,
the heart is designed. The heart is a muscle that has four pumping chambers and it has separate blood supply to each of those chambers. So we said a heart attack is when blood supply is cut off suddenly. So if blood supply is cut off to just part of the heart, yeah, you're gonna feel that pain. You're gonna lose. You may you may lose function and strength, and you may feel fatigue. But the rest of the heart will still keep struggling along until you get help. As opposed to cardiac arrest, where the entire heart stops beating at once. That's why people end up collapsing right away.
hmm. Okay. Can you is CPR needed when a person has a heart attack? Because you mentioned, or make sure the person is seated upright. Try to make sure that either you or the person is calm. But I didn't hear you speak about CPR.
Yeah. So CPR is useful, especially because somebody can collapse and be unresponsive. So
Okay.
those are if person collapses and they're unresponsive, then CPR is more important than anything else that you're doing. CPR was, but if somebody is conscious, talking to you, breathing, even if they're having some labored breathing and stuff, then I'm not saying you should do perform CPR on that patient. You should be trying to get them to the hospital immediately.
Right.
Every minute and somebody that is collapses and is unresponsive, that you every minute without CPR reduces your chances of survival by 10%. So can you imagine if you wait 10 minutes, then that's 70 to 100% chance the person will be dead already. So when I say you have literally minutes, you have literal minutes to help them.
Hmm. There are some myths that have to do with heart attack. So I'll give an example. When someone has maybe an epileptic episode, they say, "Oh, put fishy BCN, like you say, get an iron spoon able to put in between the teeth so that his teeth doesn't close," which I've heard is a myth. Yeah, it's a myth, right?
Mhm. Yes, I wouldn't. I don't know about doing. I've heard it about putting spoons, but I wouldn't do that. I wouldn't do that.
Right,
It's a
and
lot.
then you mentioned, oh, put a towel, that a damp towel maybe on the face of the. But what are other myths that you've heard when it comes to attack? Some people say, oh, drink hot water. Some people say, of course, agbo is always the one. It's the one size fits all disease killer. But are there but are there other ones that you've heard? And is there any truth to any of them?
So I'll answer your last question first. Very simply, no, there's no truth. There's no scientific evidence of any of that. Hear some of them where hot water, you can take hot water to hopefully dissolve it, or you can use these herbal concoctions. There's no evidence that any of that. You have a heart in a heart attack. You have a blocked coronary artery or artery that supplies the heart.
Mm.
Typically, it can be blocked by cholesterol or something that's really hard. You cannot use, and I'll go through the myths now. You cannot use hot water to dissolve it because your hot water is going into your digestive tract, not your circulation. And by the time it ends up in your circulation, it's body temperature anyway. Another one is palm oil.
Yeah.
They palm oil. Absolutely, absolutely not. We've talked about herbal concoctions and Advil. Another one is mix ginger and water and take that. All those things do is delay the inevitable, and the delays are deadly. So what you need are hospital-based treatments like clot busting drugs. There's a drug called TPA, and that's the gold standard of a clot busting drug. If you can get somebody TPA very soon after they've had a heart attack, you can dissolve the clot, and usually you can restore function almost right away. But that's
Mm.
one of the subscribing to any of those myths just make your death come sooner. I can say it like that.
Okay, okay, okay. Now, what are the most dangerous mistakes? Because we've talked about what you should do. What are the most dangerous mistakes that people make during a suspected heart attack?
So I'll start with one that I mentioned because I want this to be clear. I don't want people feeling that you can have a heart attack, you should just jump in the car. Um, I would say that if there's absolutely no alternative, driving oneself without properly looking for alternatives. If you're in a house and you have neighbors, of course, by far, get your neighbors to help you. Try don't drive. So that's a dangerous mistake because you could have another one. You could lose consciousness. You could also have to think you could hurt other people on the road if you lose consciousness. So but another one is people waiting for the pain to go away, and that's what most people do. Sit down, wait for the pain to go away, or another one, taking painkillers. So painkillers work on pain, right? But they're not working on the cause of the pain. So you're just muting or you're subduing symptoms that really could help save your life. Another one, like what we talked about, are misusing herbs first without doing anything, or going to sleep even. See that a lot. People just go and lie in the bed and try to sleep it off. And sometimes you come back and that person doesn't wake up. So ignoring, let me add one more, it's just on WFM, ignoring signs in women. So women that are ignoring some of the most dangerous states are ignoring those signs, ignoring the sudden fatigue, ignoring the chest discomfort if you have it, any of those symptoms. The biggest killer besides the heart attack is delay in getting treatment. And we'll keep stressing that throughout the broadcast.
Hmm. Okay, okay, okay. And in Nigeria, where a lot of us we delay going to the hospital, we don't want to go to the hospital. How dangerous is that delay, especially with regards, a heart attack?
It's extremely dangerous. Coming from the U.S. and we call those developed countries. I kind of don't like that term, and I don't like first world and third world, but the countries are different. In the U.S., somebody has that thing. Instead of looking for a neighbor, they just grab the phone and dial 911 and whisper into that phone. And within minutes, in almost every place in America, an ambulance will show up to take you to a nearby hospital. So that's why, on average, people that have heart attack in those environments, within an hour to an hour and a half, they're in the hospital. In Nigeria, patients present our earliest 6 hours, often 24 hours after. And I see that in my own practice where patients like, yeah, I even see it weeks after. Oh, yeah, I had this terrible, terrible chest pain. Girl, is it look to the wife? Is it 2 weeks? Is it up to 2 weeks ago? And you do an ECG and say like, man, your cholesterol is through the roof. You have you look at the ECG, you have something called Q waves, which shows that you may have had heart damage in the past. So, that's the biggest difference that I see. We have access to these drugs, we have access to these treatments, but us getting there and the timing of getting there is what makes it extremely dangerous for doing.
I think for what I'm even hearing you say from here is that we need to pay more attention to our bodies, because I'm never going to lie. Sometimes when I go to the hospital and they ask me, "Oh, when was the last time?" I'm like, I think it was Tuesday. Oh no, it was Monday. Oh no, it was last week. Like I can't figure out when. And because if you can't figure out when you start noticing the pain or the discomfort, it's sort of difficult for the doctor to be able to know how to address it, right?
Very true. That's very
Let's go to the hospital. Oh.
true.
At this point,
Yeah, like
actually,
I said,
actually, if you
any
have
pain and
HMO,
discomfort is not normal.
pardon, say that again.
What I keep saying, like any pain is not normal. It's usually an early warning sign, or any kind of sudden discomfort is not normal. You go and get checked out properly.
Hmm. At the risk of sounding like a broken record, of course, we're going to get to this point. Lifestyle habits.
Mhm.
We can't not talk about lifestyle habits when Dr. Viola is around. So,
Yeah.
how important are lifestyle habits? What kind of lifestyle habits increase the risk of someone having a heart attack and all of that?
So the easiest way to answer that question is to look at risk factors, right? The major risk factors. One of the major risk factors is hypertension or high blood pressure. And Nigeria, in all of Africa, Nigeria has one of the highest rates of high blood pressure. One in every three adults has high blood pressure. And like we said in previous broadcasts, we're seeing high blood pressure in those anywhere from age 20 up. We're seeing it, and 40% of high blood pressure occurs in people under the age of 50 in Nigeria. So it's highly prevalent. In the states, is even higher. It's almost 50% of adults have high blood pressure,
Mm,
and I'm very sure that if you look at what caused it, you can now tie a lot of that into lifestyle things
right.
like smoking, being obese, physical inactivity, living that sedentary lifestyle. Other risk factors are, of course, diabetes, right? So I put diabetes very high on the list, and what we call dyslipidemia, which is high cholesterol. Right? Because remember, we talked about blockage of the arteries, and at times, oftentimes, high cholesterol is what can cause those blockages. Now,
Mm,
the one of the ones that I always harp on is excess carbohydrates, especially refined carbohydrates. So this is your bleached bread and your bleached rice and your all those kind of refined carbohydrates. Also put you at risk. And seed oils, I always mention seed oils, which are like your canola oil, your sunflower, anything made from a seed, anything other than butter, coconut oil, and palm oil. Those crushed seed oils can, over time, lead to high blood pressure, heart attack, and even stroke.
mm. Lastly, because I mean, you already touched on it a little bit before we go. Someone, because you had mentioned that, oh, people who have hypertension, blood pressure at risk, like anything can happen. But is there a direct line from people who have high blood pressure or diabetes to being at risk of a heart attack?
100%. So
Okay.
if I if you include, so there's something called metabolic disease, and metabolic
Okay.
disease is, make it simple, high blood pressure and diabetes together. Those are the number one killers of men and women. Number one, undisputed top killer of men and women worldwide, including in Nigeria.
Mm-hmm.
So yes, there's a direct risk. We always talk about high blood pressure or hypertension as being a silent killer. Diabetes, diabetes is also the same way. You in rare occasions you have a diabetic attack. Where somebody goes into crisis and all of that. But typically these things start slow,
Mm-hmm.
and high blood pressure and diabetes can affect your arteries. So the artery damage, slow over time. And what I hear all the time somebody that may have diagnosed them with chest pain, or I'm sorry, with heart attack or anything like that. But I felt fine yesterday. Is what it, but I was just fine. Or I did a checkup just 2 years ago. You know, it 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 can slowly, things can happen slowly over
Mm-hmm.
time. You
Over
know,
time.
so and feeling fine does not make you safe, right? You may feel safe, but feeling fine does not make you safe. If you have high blood pressure, diabetes, or high cholesterol, you are at risk even without any symptoms. And something I'll always say, regular checkups save lives. And if you permit me, now just saying that came to mind that let's give away some checkups,
Mm.
right? So anybody that's worried about high blood pressure, diabetes, or cholesterol, contact us on social media, call my number, and we'll set up something for you. So we'll check you for at least one or two or three, all three of them, depending on your risk factors. But that's a little bit I can do to get the word out.
Thank you so much, Dr. Abiola. I think people that did not call, you will not call, but then you go and take up all the slots at ROA. I'm watching you with my eye. I'm watching you with my eye. But
Just be
yeah,
sure to WFM. You got to say WFM when you make
you
the
have to
call.
say WF exactly. You have to say WFM and follow us on social media as well. And follow Dr. Abiola, RS Specialist Hospital on social media as well. Dr. Bella, thank you so much for today's today's Radio Doctor episode on heart attacks, early signs, and emergency response. Today was very informative. And I know somebody's listening. Oh, I've listened to something like this before. No. And even if you have, I mean, you have to keep on mentioning these things because, for instance, the example that Dr. Bella gave, you did a test yesterday or last month and you think you're okay, but maybe your lifestyle habits have gone down to zero between that time and now. So we can't overemphasize these things because it's really, really for our health, yours and mine as well. And Dr. Biola has been gracious enough to give us free tests. So as you go there, shall go there and mention WFM. If you don't mention WFM, or yours is your case, okay, all right. For consultation, maybe you want to go, the brother says you call his number 0913 579 5108 or 080 888 626 35. Those are the numbers to call. You can also reach Dr. Biola on their social media pages, ROA Specialist Hospital. Okay, for whatever consultation or whatever it is that you want to do. Once again, Dr. Bella, thank you so much for coming on the show this morning. Yeah, person.
My, my pleasure. See you in March.
See,
The best
see,
month.
see, look at that. Thank you so much, Dr. Bella. Enjoy your weekend.
Same to you. Take care.
Many take care. Many thanks to the producer Aisha Sunny. Many thanks to Benjamin in the studio and Hillary. Thank you so much as well to the executive producer Tomoki Wale Shanaya. My name is Phoebe Bangbala. Do have a healthy day.